Are you okay?
I think I stepped on a nail. Oh my god. Tanner!
Yeah?
My foot still hurts.
I told you should have went to the doctor right when it happened.
Well, it's been a week. Like, I mean, it still kind of hurts, but I think it's gonna be fine.
It's gonna be all fine. Are you sure?
Yeah.
I mean,
yeah.
is it pretty painful still?
It's kind of painful, but I'll be fine. I'm gonna wait it out.
Are you sure?
Mm-hmm. Yeah.
All right.
Tanner! We gotta go to the doctor.
It's been 2 weeks. So.
Yeah, well, we need to go now.
All right.
Hi, Doc. I've been having some problems lately. So I stepped on a nail a few weeks back, and the spot where I stepped on it is still really, really hurting. And at first it was just like the spot, and then I had like kind of some tightness in my legs, but now my whole body is tight, and I'm having some trouble swallowing, and my neck feels really tight, and let's see what else. And I'm like kind of feverish too a little bit.
All right, well, let's have a look. What do you think?
Thinking tetanus.
Yeah. So it looks like you've contracted tetanus. Now I can't be sure because we can't test for this, but you're showing all the symptoms.
What do you mean you can't test for it?
It's not something the lab tests for.
So why do you think it's tetanus then?
Well, several indicators. First of all, she has a puncture wound in the foot especially. It has redness and swelling associated with tetanus. You said that she was barefoot at an ultimate frisbee match and got stepped on a nail or something like that.
Yep.
So tetanus typically comes in through puncture wounds because it's an anaerobic bacteria, which means that it can survive without oxygen. And finally, you mentioned some muscle spasms, which are very, very characteristic of a tetanus infection.
Oh my goodness, is it infectious?
No, fortunately, tetanus is not contagious.
Thank goodness. That could have been bad for both of us.
Okay, so how do we cure it?
Actually, there's also no cure for tetanus. It's treated to control symptoms and reduce the effects of tetanus toxins on the nervous system.
Toxins in the nervous systems? How does that work?
Right, so the bacterium produces a toxin that binds to your inhibitory nerve cells. It gets taken up by them and cleaves a protein that's necessary for them to work, so that deregulates your inhibitory nerve cells, sending you into spastic paralysis. Those spasms will vary depending on the age and condition of the patient, a little bit over your overall health, but you haven't had severe spasms so far, and according to you, it happened about 2 weeks ago, right?
Yep, exactly 2 weeks ago when we were playing frisbee.
So that's good.
Yep.
Alright, so the longer it takes the disease to progress, generally the better the prognosis will be. Faster is usually worse in the long run, and I don't mean to alarm you, but up to 20% of cases can be fatal. If this would have progressed, you could have experienced the muscles around your jaw becoming locked. The muscles you use for normal breathing also will eventually go into spastic paralysis, prohibiting you from breathing properly. There's also the possibility for infections of the lungs, which could lead to death, so it's a good thing you came in when you did.
Now, Katie, let's not scare our patient. The important thing is that she came in when she did. So the great thing is that now we've diagnosed it, now we can treat it.
Okay, great. So if we can't cure it, can you at least help me with my symptoms? Like,
Yeah.
what do you have for me?
Yeah, so I can prescribe a couple of things. So our first line is going to be antibiotics. We're going to try to get the living bacterium out of your system. Unfortunately, once the toxin's already in, we can't do much about that other than treating the symptoms. So for that, I'm going to just prescribe you some diazepam. That's a potent antispasmodic that will keep you from having too severe spastic paralysis. It works as a muscle relaxant, and it should do the trick. We also have the option to inject tetanus immunoglobulin into your system, but it looks like you've passed that window in which that would be effective since it's been 2 weeks since the incident.
Okay, so I think I've heard that some of the medicines have nasty side effects. Are these going to do that to me? Like, are they going to give me some bad side effects?
Well, first, for tetanus immunoglobulin, you could have slight soreness and temperature increase at the site of infection. This is most common side effect. In rare cases, sensitization, anti-neurotic edema, which is swelling of the tissue near the site of infection. Neurotic syndrome and anaphylactic shock after injection. Now, for diazepam, there is more extensive list of possible side effects. When you get released from the hospital, your nurse will give you a list of possible symptoms, which you should watch for. As for now, we will give you just a few to be aware of. Memory loss, drowsiness, dizziness, muscle weakness, and nausea. Also, there are possible side effects for both drugs. They're essential for your recovery.
So I can take her home today and take care of her?
Yeah, I'm afraid we're really going to want you in the hospital for this. This has a potential to make your respiratory muscles spasm, so we're definitely going to want a ventilator and reach if that happens.
Am I gonna die?
Don't believe so.
We're optimistic of your recovery to your pre-disease self. It's essential that you came in when you did, because the longer you would have waited, the more grim the outcome. It'll be a slow recovery process, probably 2 to 4 months. You will also have to receive vaccines for tetanus, because being exposed to it doesn't give you immunity. Which brings me to the question, why you are not up to date on your tetanus immunizations to begin with?
Yes, Katie, I was wondering the same thing.
Well, I'm sure she's had her shots when she was younger. Isn't that all you need?
Let me grab her chart and take a look.
Yeah, it says here that she did have her first Tdap vaccine, which actually protects against tetanus, diphtheria, and pertussis. Then you also received the 2 boosters that come after, which protect against tetanus and diphtheria. But it looks to me like you missed your last TD booster, which expired 2 years ago. You need that every 10 years.
Oh, well, that's probably because I haven't been to the doctor in 2 years. I've been skipping all my checkups.
I told you, Kelsey. You should have went to the doctor. Now look where you are. All this could have been easily prevented.
Geez, Tanner, stop yelling at me. I don't want to cause a scene.
Well, Kelsey and Tanner, we're headed out for now. I'll page a nurse to have you admitted to the hospital. I'll be around later this afternoon to check up on you, make sure you've got your medications. In the meantime, try not to worry. We'll get you all patched up so you can be up on that ultimate frisbee field again soon.
All right, thanks, Doc.
Thank you. Appreciate it. Thank
Thank you.
You're welcome.
Oh wow, that was crazy. I've heard of tetanus, but I've never actually seen a real case. I looked up an article before we saw the patient because I suspected tetanus from reading her signs and symptoms. Have you ever seen any research done before?
Yeah, actually last week there was a paper done by UCL scientists looking at how the tetanus toxin enters the neurons and inhibits the inhibitory neurons. With any luck, they'll be able to use this research to make new treatments and new therapy options available for patients. This has been a huge victory, not only better understanding tetanus, but a whole range of neurologic disorders.
Oh wow, it sounds like it'd be very beneficial for our patients. I hate seeing people in pain. The article that I read this morning from Spain was actually looking more at the toxin called carboxytetanol-domain.
Oh yeah, the one where the researchers in Barcelona found that the toxin stops serotonin from being transported through the synaptic membranes, right?
Yeah, that was the one.
Yeah, that article explained that compared to the serotonin inhibitors, the tetanus toxin is much more powerful. It's actually second only to botulinum toxin in overall LD50s. The research thought that by turning this toxin into a drug, because it's also highly specific, we might be able to help even such diseases as Parkinson's, depression, maybe even anorexia. The articles are still very early on in the research though.
Yeah. Looks like there's still a lot of learning to be done in this field. Hopefully in the near future, there'll be no cases of tetanus.
Yeah, that's what we hope.